need to know this. Republicans are literally forcing hospitals to close their doors. Last week, the Lower Oconee Community Hospital in Glenwood, Georgia, announced that it would shut its doors for good. That facility has been struggling with its finances for years, but things got really bad over the past few months, and the hospital had to lay off almost 100 of its employees. According to Lower Oconee CEO Karen O'Neill, the hospital's problems were the result of strained resources. And the reason why, of course, is that Republicans have refused to take Medicaid money that goes to hospitals to pay for uninsured people. Wheeler County, Georgia, where Lower Oconee is located, is the type of place that the Affordable Care Act, Obamacare, was supposed to help. Back during the Reagan administration, a law was passed that said that hospitals had to accept patients in emergency rooms regardless of their ability to pay. That created an enormous expense for hospitals, particularly in areas where there's a lot of uninsured people. 1 in 4 Wheeler County residents do not have health insurance. 1 in 10 are unemployed. 40% of its children live in poverty. The only problem is Georgia Republicans have done everything they can to make sure that Obamacare won't help those people who live there. That's because, like Republican lawmakers in 25 other states across the country, Georgia Republicans have blocked Obamacare's Medicaid expansion. The idea behind Obamacare's Medicaid expansion is really pretty simple. States that accept the expansion allow people earning as much as 133% of the poverty line to enroll in Medicaid. In exchange, the federal government pays 100% of the cost of their health care for 3 years, and 90% of that cost every year after that, forever. For struggling rural health care providers like Lower Oconee Hospital, Medicaid expansion means the difference between staying open and shutting down. As the Albany Herald recently pointed out in an article about Lower Oconee's closing, Medicaid expansion helps rural hospitals by turning many of their uninsured patients into paying patients. Unfortunately, Georgia Governor Nathan Deal and other Peach State Republicans have decided it's more important to sabotage President Obama's signature achievement than it is to help the people who put them into office. Thanks to their refusal to expand Medicaid, as many as 15 other Georgia hospitals may be shutting their doors in coming months. But it's not just Georgia hospitals that are struggling to stay afloat without access to expanded Medicaid funds. According to the Tennessee Justice Center, almost half of the 61 rural hospitals in Tennessee may face major cuts or closure without Medicaid expansion. When hospitals close down, people have to find a new way to see the doctor. And for people who live in rural areas, this often means having to drive tens, in some cases many more, miles away to get to the nearest hospital. Whereas hospital closures don't just hurt the patients, they hurt the hospital workers as well. According to some estimates, struggling hospitals have laid off almost 5,000 people just since June, mostly in Republican states that have refused to expand Medicaid. Whatever way you look at it, the Republican refusal to expand Medicaid is a disaster. It's a disaster for healthcare providers, it's a disaster for hospitals, and most importantly, it's a disaster for working people who just want to get access to affordable health insurance. Republicans made a huge stink back in October when it was revealed that Obamacare would force a tiny minority of Americans to change their health care plans. So now that their sabotage efforts are literally forcing Americans to lose hospitals, will they come around to support Medicaid expansion?